You've probably had days like this. You wake up, your back is already grumbling, and you think, if it's this bad at home, what am I supposed to do? Drive somewhere and suffer in a waiting room. So you take a pill, find a position that hurts the least, turn on the TV, and quietly hope it doesn't get worse. Deep down, a scary thought shows up. If I can't fix this at home, maybe I really can't fix it at all. Here's the part almost no one over 60 is told clearly enough. There are simple things you can do in your own living room with no equipment that can turn the volume down on back pain and help your body cope better over time. Not miracle cures, not one stretch to fix everything, but 3 practical tools you can actually remember and repeat on a bad day. In this video, you'll see exactly what those 3 at-home strategies are, how to do them safely with an older, sensitive back, and how to combine them so you feel a little less at the mercy of your pain. Starting today, you've probably had this thought on a bad day. If I want real back pain relief, I have to go to a clinic, get injections, or take stronger pills. There's not much I can do at home, yet most of your actual life happens at home, in your bed, in your chair, in your kitchen. That is where your back hurts, and that is also where you have more power than you've been told. In this video, you will learn 3 simple, no-equipment strategies you can use at home to calm back pain and support healing. Gentle movement, smart positioning, and basic mind-body calming. These are not magic tricks. They are approaches that large guidelines now recommend as first-line, non-drug care for chronic low back pain in adults, including older adults. My name is Dr. Robert Ellis. For more than 20 years working with people over 50, I've seen the same pattern. Those who rely only on medications and appointments often feel stuck. Those who learn a few home tools and use them regularly usually gain more comfort and confidence between visits. Let's start with what the science actually says about back pain relief you can create in your own living room. Major guidelines and reviews agree on a few key points. For most back pain, especially when it's been around for a while, staying active and using exercise is more helpful than long rest. Home-based exercise programs, tailored to the person, can reduce pain and disability and are as effective as standard clinic-based treatments in the long term. Non-drug options like physical activity, education, and mind-body strategies are recommended early, before heavy medications or invasive procedures, particularly in older adults. One study of a home-based exercise program for people with chronic low back pain found that doing individualized exercises at home led to reduced pain, less fear of movement, and better function, and was at least as effective as standard therapy, sometimes more effective in the long term. Broad reviews of chronic low back pain treatments conclude that exercise of almost any reasonable type, psychological strategies like mindfulness or cognitive behavioral approaches, and self-management education all have evidence for improving pain and quality of life. The World Health Organization's guideline for chronic low back pain in adults specifically focuses on non-surgical treatments that can be delivered in primary and community settings, emphasizing exercise, education, and mind-body approaches rather than injections or surgery. So you are not settling when you use home strategies. You are using exactly the kinds of tools the best guidelines recommend. The systemic enemy here is not your age, not your MRI, not even your arthritis. It is the belief that relief must come from outside, a pill, a shot, a treatment someone does to you. That belief leaves you waiting and worrying between appointments. It also means that on a bad day at home, you may feel you have only two options: do nothing and suffer, or take more medication and hope. Guidelines and research on self-management tell a different story. People who learn and use active strategies at home, simple exercises, posture and activity tweaks, and basic pain coping skills, often have fewer bad days, lower disability, and more sense of control. This video will not tell you to throw away your medications or skip your doctor. It will show you 3 home tools that can sit alongside your medical care, and in many cases, reduce how desperately you rely on it. Let's give a name to the pattern that keeps many older adults stuck. Relief helplessness. Relief helplessness feels like this. If I'm not at the clinic or on medication, I can't really do anything for my back. When pain flares at home, I just wait for it to pass and hope it's not a bad one. Over time, this leads to less movement out of fear or frustration, more stiffness and deconditioning, and a stronger belief that your back is in charge and you're just along for the ride. The 3 home strategies we'll walk through are designed to break that pattern. None of them are miracles, but each one gives you something useful to do when pain is present. And over weeks and months, that can change the whole trajectory of your back. Home Strategy 1. Gentle movement snacks. The lowest impact with a big payoff over time. Instead of long rest, you give your back small doses of movement throughout the day. Easy walking, simple back-friendly exercises, and gentle stretches. This improves blood flow and nutrition to spinal tissues, reduces stiffness from prolonged sitting or lying, and strengthens the muscles that support your spine. Even a 5 to 10 minute walk around the house or yard counts. Guidelines for older adults recommend moderate aerobic activity over the week and 2 days of strengthening, but that can be broken into very short bouts. Reputable sources for home programs suggest basic moves like gentle pelvic tilts, knee to chest, or partial knee to chest, cat-cow type movements, and light bridges or sit-to-stands for strength, adjusted to your level. A Mayo Clinic guide, for example, outlines a 15-minute daily routine of back strengthening and stretching that can help prevent or reduce back pain when done consistently. Gentle stretching that targets hips, hamstrings, and low back with comfortable non-bouncing stretches can ease tension and improve mobility. A study of home-based exercise for chronic low back pain found that a structured, individualized home program significantly reduced pain and disability and was a practical, economic long-term approach. Reviews of exercise interventions repeatedly show that almost any reasonable exercise is better than none, and that classification-based or individualized programs do best. This is what lets you say, when my back tightens, I walk for a few minutes and do a couple of gentle exercises, instead of, when my back tightens, I collapse into the chair and wait. Over weeks, those movement snacks can make getting out of bed, standing up from chairs, and walking in stores noticeably easier. Home Strategy 2. Smart positions and posture breaks, a medium impact with low effort. Back pain often gets worse, not just from what we do, but from the positions we stay in, especially long, slumped sitting or awkward lying. Small, regular changes in position and a few trusted relief postures can reduce mechanical load on irritated structures, calm muscle guarding, and make pain episodes shorter and less intense. Breaking up sitting is powerful. We know from other videos and research that prolonged, slumped sitting can aggravate older backs. At home, a simple rule helps. Every 30 to 45 minutes of sitting, stand up for 1 to 2 minutes, walk to the kitchen, do a gentle stretch, or just shift your weight. Studies link high sedentary time with worse low back pain and show that breaking up sitting is a feasible way to reduce discomfort and risk. Many older adults find certain positions ease their pain. Lying on the back with knees supported on a pillow or stool. Lying on the side with a pillow between the knees. Gently leaning forward over a counter for some stenosis-type pain. Guides for older adults with back pain recommend using such positions temporarily to calm pain, especially during flares, combined with gentle movement as soon as tolerable. You do not need perfect posture to help your back. Small changes help. Adding a lumbar roll or small towel to chairs, bringing screens up closer to eye level, and keeping hips slightly higher than knees when sitting can all reduce strain.
This position,
Ergonomics
with the
and
pillows
spine
supporting
health
the knees,
resources
helps release
highlight that
tension in the
posture
lower back.
and prolonged positions
focus on your
are
breathing.
modifiable risk factors for back pain. Addressing them with simple supports and movement breaks is a key part of self-management. This turns your home into a friendlier environment for your back. Your favorite chair is adjusted, not abandoned. Your bed has a known relief setup for bad days. Your day has built-in movement breaks, rather than hours lost in one posture. Home Strategy 3. Calm the volume knob, the highest impact, and often the most ignored. Chronic back pain is not just a tissue issue. Over time, the nervous system can become more sensitive to pain. Stress, poor sleep, and fear make this worse. Simple mind-body strategies practiced at home can reduce muscle tension, lower the emotional alarm around pain, and help you cope better when pain flares. Slow breathing, for example, 4 or 5 seconds in and 6 to 8 seconds out, can reduce sympathetic arousal and muscle tension. Brief body scans, noticing tension from head to toe and softening it, can be done lying down or sitting. An early study of an 8-week mindfulness program for older adults with chronic low back pain found improvements in disability, mood, and pain severity, showing that mind-body approaches can be safe and helpful in this age group. Understanding that hurt does not always equal harm, and that movement can be safe even with some pain, can reduce fear avoidance, which is strongly linked with ongoing disability. Self-management resources often combine education with simple activity plans to empower people at home. Brief mindfulness during walking or stretching, noticing sensations without judgment, can change how threatening pain feels. Positive self-talk like, "This is a bad day, but I have tools I can use," supports psychological flexibility, which is part of effective chronic pain care. Evidence-based reviews identify
Me too.
mindfulness-based treatments and acceptance and commitment-type approaches as effective parts of chronic low back pain care, especially when combined with exercise and self-management. This is what keeps a bad day from turning into a bad week. Instead of spiraling into, "Here we go again, it's just going to get worse," you have small rituals, breathing, a short walk, a relief position, a few gentle exercises that help you ride out flares with less fear. When you put these 3 home strategies together, you are doing more than chasing relief. You are keeping your muscles and joints used to moving, reducing the impact of long sitting and awkward positions, and teaching your nervous system that not every twinge is an emergency. This supports the real goals most people over 50 care about. Walking in a store without having to stop every aisle. Getting out of bed or off the couch without a big brace and pray. Traveling, seeing family, doing chores with back pain that is managed, not in complete control. Guidelines for older adults emphasize that regular physical activity and self-management can help maintain independence and quality of life, and that recovery from back pain may be slower with age, but is still very possible. You are not aiming for a pain-free fantasy. You are aiming for more good hours, more things you can still do, and less fear of every flare. You do not need to see yourself as a back pain warrior or a fitness person. You can simply see yourself as someone who has back pain, someone who still has some tools, and someone who is willing to use small, realistic actions at home to tilt the odds in their favor. Instead of, when my back hurts, I just wait until the doctor or pills fix it. It becomes,
come here, my love.
when my back hurts,
I'm gonna
I have
miss
3
you.
things I can do at home. Move gently, adjust how I sit and lie, and calm my system. That identity, as an active partner in your own care, is one of the strongest predictors of better long-term outcomes in chronic back pain. If this made sense, here's a simple, realistic starter plan. On most days, aim for 5 to 10 minutes of gentle movement, a short walk, or a few basic back-friendly exercises from trusted sources. Add 3 posture or position changes, stand up every 30 to 45 minutes of sitting, and once or twice, use a known relief position for a few minutes. Include 5 minutes of calming practice, slow breathing, light stretching with relaxed attention, or a simple body scan. If any of this spikes your pain sharply, slow down or modify. Check with your doctor or therapist if you're
We have a
unsure
clear plan for
what
your
is
recovery,
safe for your
and we'll work
specific
together
conditions.
every step of the way.
This is Dr. Robert Ellis. If this video helped you see that back pain relief at home is not just wishful thinking, that there are concrete, evidence-supported things you can do, consider liking the video and subscribing to the channel. It helps more people over 50 find calm, practical, hopeful guidance instead of feeling stuck between pills and waiting.
Hello, Dr.
You are
Evans.
not too
Thanks for
old
calling me
to
back.
help your back.
Of course, how are you
You are
feeling?
not too
Much
late to
better,
learn
actually.
new home
The new
habits.
prescription seems to be working.
You are simply at a
Hello,
stage
everyone.
where small,
We are
consistent
so glad
steps
you're here.
taken in your own living
Welcome to
room
the neighborhood.
can quietly change how your back feels and how much of your life you still get to enjoy.